The tumor measured quite large when I got here. It was like an 8.8 centimeter or something. And 2 weeks ago with Dr. Goodyear, he remeasured and it was 4.4. And have had an ultrasound and it looks like it's got holes all over in it now. It's not like anything solid. She said it's just like it's breaking down. Patty Jones, and we are now in Tennessee. We're originally from Washington State. Ductal Carcinoma, stage 3. I had a lump that I knew of for over a year, but because I was healthy, I had no pain. Well, it was very sore, so I just thought it was a fibroid that I'd had in my breast all my life. And so I messed around until it got to stage 3. There's always a path and a plan if we listen. And I'm grateful that Brio was part of the plan for my recovery. The Lord had us leave Washington State almost 2 years ago to move to Tennessee, and the journey He's had us on for me to get to Brio was a true miracle. I started working for a wonderful couple at Fresh Pharmacy in Tennessee, and my boss Joe and Angela are very good friends with Dr. Goodyear and his wife. And so I said, Lord, we thought we were leaving Washington for a specific other reason, but you knew what was growing in my body and where I needed to be. And so it's by the grace of God I was here, that I got to work for Joe and Angela and hear about the Brio Clinic and hear about Dr. Goodyear and all the great work that they're doing. And at the first place I went to in Knoxville, they were very pushy. It was a very dark, very gloomy, and I basically left there and didn't return. Oh my goodness, anywhere from the electro, the magnetic, the light therapies, ozone therapies. That's the ozone sauna is an amazing treatment. I've had hypothermia, hyperbaric chamber, vitamin C, IV vitamin C therapy, and in Tennessee, I was doing some IV therapy with vitamin C and thought I was doing a great job. Found out it was 1.5 grams, and I get 100 grams at Brio Clinic with mistletoe a couple of days a week, and low-dose chemo, and have done amazingly well. I bless God for that too, because I'm not one that likes to be nauseated, and I have been thrilled. These have not been easy treatments. The chemo exhausts me the day after. I have not been nauseated and physically ill that way. So I was grateful for that. And the hypothermia was probably the hardest one for me. And talking to the nurses that run that, I asked why would I get so agitated, and they said being of a thin build, my body heats up faster. And so then it gets to a point of being a little uncomfortable, and my body just kind of goes, okay, we're at temp, we're gonna stay here now, we're not gonna do anything else. And so I could make it, anywhere from, I think, 3 hours to 5 at therapeutic temperature. And then my body would say, tell them you want out. And the women, they're just fabulous nursing staff. And they listen. They absolutely listen, and they don't just listen, they care about what you're saying, how you're feeling, and what your concerns are. I started talking to Tiffany at that counter for the hypothermia because that was the one that freaked me out the most, because I'm active and I did not know that I could lay still for 6 hours. So I started talking to her from the day we got here, and she was so reassuring to me. All of them were so reassuring, and they were right. They've been doing it, they know how the body reacts to that kind of temperature. And so they were a true blessing. I am thrilled. The tumor measured quite large when I got here. It was like an 8.8 centimeter or something. And 2 weeks ago with Dr. Goodyear, he remeasured and it was 4.4. And have had an ultrasound and it looks like it's got holes all over in it now. It's not like anything solid. She said it's just like it's breaking down. The tumor is breaking down. And that was wonderful. And then when I got here, I had a blood test. Detects the circulating tumor DNA in your plasma. And I started out at almost 10, it was 9.85. And a month later, it is at 0.43. So I have seen incredible results. I feel good. I've lost a lot of weight with the diet, but the nutritionist, Sarah, is fabulous about working with me and saying how to pulse the keto diet so that I can keep gaining back a little bit of weight. And, but yes, I've had excellent results. Labs now come in just absolutely wonderful. I didn't have trouble with my thyroid, but my thyroid numbers are even better than they were. So it's like, how does that happen? But you know, if your body's struggling, I guess, with a tumor, energy has to come from somewhere. And so without knowing it, things were depleting in other places and I didn't know it. And so just with the wonderful treatments, you know, and the wonderful camaraderie, you build relationships with with the fellow patients and all of the staff that is, it's just indescribable. You're all going through the same things and just different stages, different ways, and our bodies all are a little bit different, but there are people you connect with, and I'll be soul ties with some of them for the rest of my life. Don't hesitate. Do not hesitate, do not hesitate, do not hesitate. So I had a friend at church, I had prayed, Lord, I'm not going to do the regular mainstream oncology because it's just going to be too severe. But I need confirmation. Should I keep the oncology appointment in Tennessee or what should I do? And went to church, was talking to a gal who had done all the mainstream stuff years before, and now her bones are like honeycomb. They're just her bones are so fragile. And was talking to her and she said, oh no, you're gonna go. She said, because she said, it sounds like you've made your decision, but you don't want a naysayer coming up to you and instilling any doubt in the decision that you've made. You're going to get all the information you need so you can say, oh no, we've talked to everybody. Okay, Lord, thank you for the confirmation. Went to the appointment, loved the young lady, but the poison they wanted to put into my body for over 6 months was mind-boggling to me. She said, you're in great shape, good blood pressure, great weight. You could survive this. I said, sorry, I didn't come to survive anything. I want the life that Jesus Christ died for, the abundant life that he died for. And that's in a more natural way to me. That is more something nicer to the immune system, not destroying my immune system, and you have to build me up for 2 weeks with chemicals. I said, not for me. So that was the final decision. When we heard that oncology doctor say that I could survive such a radical treatment. They'd have to check my heart to make sure my heart would survive. I'd probably have neuropathy, hands and feet the rest of my life. That's not the life I love to garden. I don't know how could I ever feel anything in the earth again if I had neuropathy. A little different in the sense that, like I said, the hypothermia, I thought I was going to breeze through some of this stuff, and it's time consuming. It takes up a good part of your day. Do every treatment that you can when you're here. All of the beds, the hyperbaric, all of the therapies. Do every one of them every day when they're on your list. People here know exactly how to, and what Dr. Goodyear says, stacks, they stack these therapies because they know what works together. So do them all, do them whenever they're on your chart, and just be faithful to the program, and God will be faithful to you. To all of you who are part of my healing, from Anita with the emotional side of all that and digging up the roots of all the junk. To Michelle with lymphatic, and what a treasure that is, and Dr. Rue. To come here and find out that I can have acupuncture, which I've done off and on all my life. What a blessing. The nursing staff that is beyond caring. When they're working with you that it's about you. It is about you. They stay on top of changing your IV bags so that, because it's a process. It can be a lengthy process. Anyway, thank you all. You have been a godsend to me, and I know that that is the truth. You are a godsend to me, that I know I was led here. And Dr. G, thanks for being Joe's friend and for me, for helping him get me here. And I can't thank you all enough.